I'm Melissa Bantuck in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined with Beth Thompson. She's one of our nurse navigators here in a specialty clinic devoted specifically for young women. Hi Beth, it's great to have you.
Hi Melissa, it's great to be here.
Will you tell me some of the issues unique to young women with regards to breast cancer?
So it's unusual for women under the age of, say, 50 to be diagnosed with breast cancer. So a young woman may feel very alone when she's diagnosed. There may not be a clear answer of why she's developed breast cancer. In fact, in we only see genetic mutations in a very small percentage of those patients. So there's that persistent question of how did this happen and why have I just been diagnosed with breast cancer, which can be very distressing for young women. They may also be working hard in their careers, and they may be raising young children, and they may have some real concerns about the welfare of those young children faced with such a shocking diagnosis. So there's a lot of things that go into breast cancer being a different experience for a younger woman.
So for a topic like fertility, is that something you hear from a lot of your patients? Do patients really want to have children after breast cancer treatment?
Yes, they are. We know that they are, and yet we also know that they're not talking about it with their doctors, and we know that many of their doctors are not bringing it up. So it's this concern, and yet it's not being discussed. There are options for fertility after breast cancer, and there's a lot of data that suggests that it can be safe, but there are some real challenges. Some of those challenges involve the age of the woman, going through breast cancer and treatment, which may last for 5 years if she is on hormonal therapy after her diagnosis. And fertility does tend to decline during that time. There also are concerns about waiting a specific period of time recommended by her doctor, just during that time when recurrence is most likely to occur. So there's a lot that goes into that discussion, and we really want to encourage women to have that discussion with their doctor, preferably before treatment begins. That's really the best time where we might capture some options for her if she wants to expand her family or have a baby for the first time.
With regard to lifestyle changes, are there things that younger women have a harder time transitioning to at the end of treatment?
Well, we know that, as I said before, they are sometimes subject to more distress than an older woman. And I really do think that is because it does come as quite a shock, and she can look around and say, how did I get here and how do I get back to my life? I know I was a young breast cancer survivor. I was diagnosed at 40 and I was raising young children, and it was very difficult once treatment was over to try to figure out what was next and how was I supposed to feel, and how was I going to move forward with this experience, and what was it going to bring to the rest of my life.
Thanks. I think you bring up a lot of good points. Do you have suggestions for patients who may need to reconnect with doctors or help finding a support group after treatment?
Right, right. Well, I think support is so important, particularly for women. You know, we like to do things in groups. We like to support each other. And if a woman is very young or lives in a community where she really cannot connect with someone else who has had breast cancer at a young age, I would just really suggest that she get online. There's a lot of good support groups online now. At Hopkins here we provide a survivor-to-survivor volunteer program, and many hospitals are moving forward with programs like that. So there are things that she can do. Moreover, I think it's important to just give yourself some time. It's going to take some time to heal. And just remember that there is life after breast cancer, and it's important to wear your seatbelt and focus on your bone health and take care of your heart, because there's a lot of life worth living after breast cancer, and there's just never been a better time to hope for survivorship for a long time afterwards.
I think you bring up a lot of good points, that there are gifts of cancer, and it's helpful for patients to know that cancer doesn't have to be a death sentence.
No, it certainly isn't. And, you know, breast cancer has been around, believe it or not, for thousands of years. And I believe women have feared breast cancer for thousands of years. And as I said, there's just never been a better time. We know more now than we ever have. We wish we knew more. We wish we had even better treatments, and we will. But this is a wonderful, exciting time to hope for a long future after breast cancer. And I think women need to remember that they take that experience into the rest of their lives. We cannot choose whether we get breast cancer or not, but we can choose what that experience is going to mean as we move forward, and try to find things that add meaning and purpose to that experience instead of just having it be kind of a crummy thing that happened to you.
Thank you very much for providing your personal insight as well as your professional experiences. This has been really helpful. Thank you so much for joining us.